Well, good afternoon. Hopefully everyone's awake after lunch. And I wanted to try something that Chris tried, but I'm not going to ask you to stand up because you're probably ready to sit down. But certainly would ask you to think about, well, how many calories did you have for lunch? Do you know? And do you know what was in there, in that food that you ate? You know, I have to tell you, I'm grateful to be here. I'm grateful for the invitation. Thank you, Bill. And I think I'm here just because I have a passion around nutrition and a passion to make nutrition relevant. And from my journey through a variety of experiences over the last 25 years, I have ended up at a company that is about lifestyle and am able to really get into the homes and understand consumer behavior in a whole new way. I was glad, Chris, to see a lot of progress at J&J. J&J is near and dear to my heart. I spent 7 years there. And I was invited to come to PepsiCo for a new agenda. And I think that coincides with kind of my effort over the past 20 years, and I couldn't turn it down. So thank you for just listening for a few minutes about kind of where I've lived over the last 18 months. I think one of the most relevant thoughts that I want to leave with you and need your help is that Americans and people all over the world are told to change the way they eat, particularly after they've been diagnosed with a chronic disease. And as you know, probably better than most, millions and millions of dollars are in the healthcare system to basically reduce risk reduction around chronic disease, lifestyle diseases. But what's just been so frustrating for me is that in a lot of kind of places that I've lived, the effort or the intent to create a policy to change how individuals have their relationship with food are written for policymakers. You heard the word patient. We talk about the word consumer, and that's still jargon. It's not about the individual. And so what I've been on a trip over the last 18 months is to step in the middle of those two worlds. A patient who's been diagnosed with a chronic disease, what happens? Where do they go for help? What tools are available? What is really changing consumer behavior? And on the flip side, what happens in the consumer world and our food value system over from agriculture all the way to shelf? We call that seed to shelf, seed to fork, however you want to think about that. It's a huge system. You know, and last night as I listened, John, to your kind of real call to action on how do we change this, you know, I'm really trying to take it back down to the human experience. So when you look, you know, at this group of people, this is the new normal. And I would say 75% of Americans are metabolically compromised, and food companies in the past have always looked at marketing to a healthy population. But people really don't see that connection between nutrition and health. It's a very, very big gap, and hopefully we as a collective group who have like-minded vision to really improve health of populations around the world can really get at that interface, because for me, that's what it's going to take in order to make that change happen. You overlay that with statistics that you're bombarded with over the last several days, given the issues that are coming out of the administration. But this also affects food patterns, food consumption, and certainly how people think about filling a belly and what happens when you have $1 to spend, where do you spend it? This notion of fruits and vegetables, which I'll get to in a moment, is one of the trickiest areas that I've ever seen, not only from an agriculture perspective and what's happening in our commodity world. I just learned this week that corn prices are up 72%. And corn as a commodity in this country, as you know, affects the overall food supply. At the same time, you have individuals who do not know where their next meal is going to come from and really, really reliant on food pantries and other means to getting food on the table than ever before in our history. So when you look at innovation and you think about where we need to think even more clearly, I'm really digging into the policy areas of programs like WIC and SNAP to think about how we really look at the impact on our world. The third piece of this, before I kind of get into my wake-up call, is just how information is out there and where it's derived. Now, all of these that you see, whether it's a BMI table that was derived out of the insurance world, or whether it was our new MyPlate that's derived out of our own government, USDA and the USDA, just leave it, and the FDA, these, I think the intent is right, but the impact isn't being really felt with respect to overall food and the relationship with food and how folks eat. And for me, as I listen to consumers talk about information that's available to them, this is complicated, it's boring, it doesn't tell me what I need to go do, it tells me that I have more of a problem than I ever thought, but from an actionable perspective, it's certainly not kind of seeping through. The Nutrition Facts Panel, from a food industry perspective, if you're not aware, this really came in to kind of cite on PAC back in the early 90s, when I really first started in a role in terms of food education. And while I think it did a brilliant thing in providing transparency to food, it certainly is so complicated in terms of how you translate that to an overall diet. There's a lot of work to be done in order to really make these policies and overall guidance more effective and impactful for everyday life. So, as any of you, I've had both a professional and personal wake-up calls. And I feel like I've been on this journey for the last 20 years and finally seeing a convergence. In fact, if I kind of think about the hot spots, for those of you who were present last night for the presentation of this convergence or vergence, I feel like I'm standing on some embers in a hot spot. Because I got to tell you, the social revolution that's happening around how information can be translated and be impactful and accessible in real time certainly is making a difference in terms of how individuals take in information and certainly what they do with that. And I was part of that transplant at Second Life, which was a really amazing workshop. Hats off to the folks who did that. Because it really opened my eyes to where some palpable pockets of education and transformation is happening and how individuals are really hungry for it. But one of the most, I guess, opened my eyes in terms of an experience that I had. I'm really about a lexicon, and I know every discipline has its own lexicon, but I'm really trying to redefine what nutrition and that lexicon means and how it's interpreted so it can change consumer behavior. And earlier this year, I had an opportunity to attend a literary conference. And the goal was to go and really see what kind of lexicon is being used around health and wellness. And certainly obesity was kind of top of mind from kind of where I was, the angle that I was listening. And as I sat there and was a part of a retreat, and all of the food critics, at least from the US, Frank Bruni, Ruth Reichel, Molly O'Neill, just sat for 3 days and listened to the stories told from a literary perspective about how the culture of food has shown up, particularly in the US. And as you can appreciate, you see this every day, whether you watch Food Network or how you look at all the cooking shows or those types of food preparation shows that are now front and center and celebrities. I sat, and for the third day, I'm like, this is really a positive conference. I'm used to wearing the Kevlar vest. You talked about sugar. I'll admit it. It's, we are who we are, and we're really out there looking for new solutions. But I went into that conference thinking, what am I going to hear about, the drama around obesity? And in essence, not a thing. In fact, it was the most positive conference that I've attended in a really, really long time. And I came out of there really renewed with a lot of passion around this possibility of an addiction to health versus looking at addiction in a more negative way. And so last day, there was a gentleman, a brave gentleman, who stood up in the back row, and he says this to Molly O'Neill. And if you know Molly O'Neill, you'll understand the context a little bit. But I was waiting for his question. He said, none of you have talked about obesity. And obesity is the #1 issue in this country. And I'm not understanding why you're not addressing that. You know, and all the panels kind of looked at each other as if to say, why are you asking us this? This is not even, you know, relevant to what we're talking about. And ultimately, Ruth Reichel, you know, took a stab at it and said, look, what you need to do is go to Washington and change the tax structure and the incentives for getting everybody on the same page, because we're all backing into this in our own way with the right intent, but we're not having the impact that we want to have. And if anything this world needs right now is a positive environment to which to motivate to change. And right now, with the media hype and everything that's going on, the negativity versus the positivity, we're trying to turn that tide. It's like, wow, what can I do? I mean, and that was my wake-up call. How do I really start rolling my sleeves up? You know, in essence, get into this and think differently about solutions that can be brought forth. And I've ended up collaborating with just such a diverse group of people who have a shared vision. And I think we're making progress. I can't share anything today with specific to what's coming out of the pipeline, but I will say hopefully next year we'll be able to share some of the kind of journey that we've been on in terms of that positivity and what's happening. So why PepsiCo? This is the corporate creativity section, and you know, I'm really proud of this because if you just read the small blurb, it was really about the nutrition journey that we've been on. And I know, I'll just lay it out there because I think somebody would want to ask, well, what does PepsiCo have to do with nutrition? And I shared with you a little bit about why I joined, but PepsiCo is usually equated with Pepsi, not the $19 billion brands that we have all over the world. In essence, when you look at our the number one category that we have, it's our macro snack category. The number two category that we have is our beverage category. But the number three is our nutrition products, whether it's Wimbledon in Russia with a whole host of dairy and infant formula, whether it's our Quaker brand, which is predominant in the US but gaining share all over the world, or Tropicana, which you had for breakfast this morning. That's where we are. And for me, I have access to every country in the world, every consumer's home in the United States, with an opportunity to learn. And I wanted to share, this is my boss. He's our chief scientific officer. Many of you from Mayo knows that he hailed here for a while, and you may know Mahmoud Khan. He has a big vision. He's an endocrinologist, but he also recently became our CEO of what we're calling our Global Nutrition Group, which is a $13 billion division of PepsiCo. And why I wanted to put this up is he came to PepsiCo with the same fervor of really uniquely understanding what we can do to really have an impact on the population from a health perspective. And he brought that Mayo buzz with him, I'm telling you. He's really rocking through the company and making people think differently about our strategies and our journeys and reinventing ourselves and truly transforming a company that's now the second largest food and beverage company in the world. And when I looked at the strategy, and again, this is the 2010 USDA dietary guidelines for Americans, this is the PepsiCo $30 billion growth goal for 2020, taking a $13 billion division into a $30 billion division with a focus on fruits, vegetables, whole grains, protein, and dairy. Now, if there's not any other direct relationship with a policy and consumer behavior, I'm not sure where that overlay is as seamless and as perfect as this. But when you look at our brands, a lot of folks think, well, that's what's the most palpable. But when you look at this plate and you understand our role in agriculture, our role in distribution, our role in ultimately taking those barriers down so consumers will adopt, in essence, I think we have a lot to contribute to where we're headed from a lifestyle, reduction in terms of disease. This is how fruits and vegetables kind of show up in the media. And I laugh at this because it is a beautiful variety of color and certainly something that we want to really increase in our own diets to improve our health. And in essence, when you look at this though, one thing that I would just share with you is individuals really don't know what to do with it. And so if there's anything that we can do is food preparation, understand perishability. I really applaud Walmart for what they're doing and trying to bring fruits and vegetables to the center of their store. They have an aggressive goal in terms of consumption. And in essence, but what's missing and what's lagging is if I have $1 to spend and I only have $10 and I'm afraid that a fruit or a vegetable is going to go bad in my refrigerator, I'm not going to spend that. And that's the #1 reason why a lot of the purchases of fruits and vegetables aren't where we want them to be. So from a technology perspective, there's a lot to do. And in fact, if you look at the recommendations for fruit and vegetables, we don't have enough land in the US to meet the need if everybody ate their 5 a day. So we're totally looking at the overall landscape. So I'll leave you with this, because this to me is really where my mental model lies. And there's a lot of different themes around this, but for me it's about the translation. It's also about your relationship with food. And my biggest frustration right now is a lot of the guidance that comes out is just a list of don'ts. And it's also surrounded with a lot of negative tone. And there's something really, really important about redefining a relationship with food, because as you can appreciate, food is very personal. It's cultural, it's social, and there's so much to it that it's not just writing a policy like the USDA dietary guidelines and expecting individuals to pick that up and translate that and put it into practice in their home every day. And so what I'm asking you to join me is I really have gone after that process. And just to give you a hint to that, our guidelines came out for the 2010, and we're already in 2011. And if you want to change the guidelines in 2015, you have to have research published by January of 2013. I'm like, where's the innovation roadmap? And so I've asked that question so many times. I was invited to Bethesda at the end of the month to really talk about exploiting the process and really trying to figure out how to get people on the same page with changing that understanding. Because if food and lifestyle, diet and lifestyle, nutrition, and all that comes with that is so, so critical in really turning this tide around what's become our new normal for metabolic disease in this country, then I think we need to figure out how to work together and collaborate and get something new done. Thank you very much.